Good afternoon, everyone. I'm Philip Osteen, Dean of the University of Utah College of Social Work. Welcome to today's Social Work Beyond the Classroom presentation. This series allows us to delve into the work that engages our faculty members outside of their teaching duties and to provide additional learning opportunities to students, graduates, and others in our community. Thank you to all of our virtual attendees for making time to join us, those of you who are live, and those who are watching this recording at a later time. We express a sincere gratitude to those who donated while registering. These donations will support the Daniels Martinez Endowed BSW Scholarship, which was established in 2010 by MSW alum Deborah Daniels and Kai Medina Martinez. Deborah Daniels served as the third director of the University of Utah's Women's Resource Center, retiring in 2020 after 17 years of facilitating an array of personalized student support services to our campus. So again, to everyone who donated, we are grateful for your generosity. Thank you. Before we get to today's presentation, on behalf of the College of Social Work, I want to acknowledge that this land, which is named for the Ute tribe, is a traditional ancestral homeland of the Shoshone, Paiute, Goshute, and Ute tribes. The University of Utah recognizes and respects the endearing relationship that exists between many indigenous peoples in their traditional homelands. We respect the sovereign relationship between tribes, states, and the federal government, and we affirm the University of Utah's commitment to a partnership with Native nations and urban Indian communities through research, education, and community outreach activities. Today, we are excited to showcase one of our newest faculty members, Dr. Julia O'Connor, and her latest research and data-informed approaches to addressing dating and sexual violence on college campuses and support survivors in a variety of ways. Dr. O'Connor is an assistant professor here at the College of Social Work. She earned her PhD from Rutgers University, an MSW from the University of Maryland, Baltimore, and an MPH from Johns Hopkins University. Dr. O'Connor's research centers on domestic and sexual violence with a focus on campus violence prevention, including preventing violent behaviors before they occur. Her work explores the attitudes and beliefs associated with perpetration, identifying risk and protective factors, and examining the profiles and pathways of individuals who perpetrate violence. Her broader research interests include assessing institutional and campus responses to violence, understanding the unique experience of marginalized survivors of violence, and exploring the lasting impacts on survivors. Dr. Connor's research is informed by her professional background as a case manager, women's advocate, and felony-level legal advocate, providing direct support to survivors of sexual and domestic violence. As we move through today's presentation, I encourage you to use the Q&A button at the bottom of your screen to put questions in for Dr. O'Connor to address at a different time. And with that, Julia, I turn it over to you. Thanks for being here today.
Thank you, Dean Osteen, and good afternoon, everyone. Thank you so much for being here today. I'm really excited to talk to you all about this important topic. Today, I'm going to be talking to you about building safe campuses, understanding dating and sexual violence, and supporting survivors on campus. So today I will cover several different topics. These include an introduction to campus violence, assessment and safety planning, how to respond to disclosures of violence, and then at the very end, I will share some important resources for you all. Just a note, some of the topics I will cover today may be upsetting to some of you. I will discuss violence. Please take care of yourself as best you know how throughout this presentation. So before we dive into learning about how to support survivors of violence, I'd first like to talk about the different types of violence, rates, or the scope of violence, and of course, the impact that violence has on those who are survivors of violence. To start us off, let's learn more and understand about the types of violence that survivors most commonly face. So intimate partner violence or domestic violence is abuse that occurs in romantic relationships. And please note that I will use the terms both domestic violence and intimate partner violence interchangeably throughout this presentation. These types of violence vary in terms of how often they occur and also how severe it is. So it could range from one episode of violence that could have lasting impacts to more chronic, severe episodes over multiple years. Overall, domestic violence is a pattern of controlling behavior that can include many subtypes of violence, such as emotional, physical, sexual, economic, technology-based, or technology-facilitated. And I will be discussing more about these subtypes in the following slides. Psychological or emotional abuse is the use of verbal and nonverbal communication with the intent to harm a partner mentally or emotionally and/or to exert control over that partner. It includes a number of different tactics or behaviors, including put downs, making a person feel bad about themselves, name calling, making a person feel guilty, and humiliation, among others. Emotional abuse is the most common form of abuse, and yet it is not always seen. So we often say that it is a hidden form of abuse, but it can happen to anyone at any time, anywhere. Many survivors report that emotional abuse is actually more damaging than the physical abuse that they endure. And we know through research that this type of abuse is strongly associated with negative mental health effects such as depression, PTSD, and anxiety. Intimidation is often part of emotional abuse. For this tactic, abusers might frighten victims with certain gestures, looks, weapons, or even destroying property. Intimidation is also part of stalking, which is a pattern of repeated unwanted attention and contact by a partner that causes concern for one's own safety or also concern for the safety of someone close to the victim. And intimidation can really stick with survivors of violence. It causes them to have a great deal of anxiety and even to back down when it comes to their abuser, and ultimately often keeps victims locked within relationships and unable to leave for fear of what will happen. Another common tactic of emotional abuse is isolation and using isolation against the victim. This includes things like controlling the victim's behavior, limiting who they can see and who they can talk to, making someone account for their actions and whereabouts, telling somebody that they will not be believed if they report the abuse, and never letting the survivor go out alone. Isolation is another form of abuse that often keeps survivors locked in relationships where they are not able to leave, often because they can't access the social supports that they would need in order to leave an abusive relationship. Physical violence is when a person hurts or tries to hurt a partner by hitting, kicking, or using other types of physical force. Other types of physical force include punching, slapping, strangling, using or threatening to use weapons, throwing things, destroying property, and even denying medical treatment for injuries or for other medical conditions. And this is among other types of behaviors as well. Sexual abuse is one type of physical violence, and this includes unwanted sexual contact. A person may use force, threats, manipulation, or coercion to commit sexual violence. And we know that sexual violence is forcing or attempting to force a partner to take part in a sex act, sexual touching, or even a non-physical sexual event such as sexting or sharing pictures when the partner does not want or cannot consent. And there are many types of sexual violence, like the other types of abuse that I've gone over, including rape or attempted rape, unwanted touching, sharing of pictures or other materials such as videos without the partner's consent, and also reproductive coercion. And reproductive coercion, for those who are not familiar with that term, means, for example, not allowing a partner to use birth control, or conversely, forcing them to use birth control even when they do not want to. Economic abuse is a less known form of abuse, but it can have serious long-term impacts on survivors. And also it can seriously hinder their ability to leave an abusive partner or an abusive relationship. Types of economic abuse include job sabotage, so that somebody cannot keep their job, or not allowing a partner to have a job at all, or conversely requiring somebody to provide financially for the entire family, interference with work or education, taking credit cards and even running up debt in the partner's name, or keeping the partner's name off of important assets like a mortgage, so that if they leave, they have limited means to actually leave that relationship. The final type of abuse that I want to touch on is called technology-facilitated abuse. And this is particularly pervasive among college students and younger generations. It includes a number of different behaviors, among them incessant texting or calling, use of surveillance apps, spyware, or other tracking devices, and perpetration of abuse over social media or other networking platforms. Additionally, technology-facilitated abuse is often part of stalking, and stalking is particularly hard to prove for survivors who maybe are seeking relief through the court system, such as a protection order, which I'll talk about later, because it is just very hard to prove over time. It's also particularly scary for survivors, again, keeping them from leaving abusive or unhealthy relationships. Okay, so now that we have a basic understanding of what types of violence survivors face, let's talk about the scope of the problem. That is, how many people are affected. And first, I'd just like to point out that anyone can experience violence, regardless of factors such as age, race, class, gender, lifestyle. But some groups face greater risk and also greater harms or negative outcomes from violence. Unfortunately, the numbers are staggering. We know that 1 in 3 women will experience sexual or physical violence from a current or former partner over the course of their lifetime. 1 in 5 homicide victims will be killed by an intimate partner, and more than 50% of female homicide victims are killed by a current or former partner. Additionally, research shows elevated risk and rates for Black, multiracial, Latina, and LGBT individuals. Younger women experience violence at double the rate of older women. And in fact, we know that 1 in 3 teens will experience interpersonal violence, either physical, sexual, or emotional abuse from somebody they are in a relationship with. Additionally, 1 in 4 college women will experience sexual violence, and another 1 in 4 college women will experience dating violence by the time they graduate from college. So the numbers are staggering, right? The impact, the number of people affected is huge. But in terms of how it impacts survivors, we know that violence has severe negative impacts on survivors. And also, unfortunately, there are those who don't survive incidents of violence. Violence has negative impacts across all domains, including physical and mental health, work, and housing. For instance, research shows us that the relationship between domestic violence and PTSD, post-traumatic stress disorder, is well documented. PTSD makes it more difficult to leave a violent relationship and also increases physical and mental health issues such as substance abuse. Violence also negatively impacts other domains that we might not think about readily, such as children, pets, and social systems. And finally, demographic characteristics such as age and gender affect the risk of violence and the harms that survivors face. For example, we know that factors such as immigration status and language or literacy are barriers to survivors when they go to seek help or to leave abusive relationships. Research also shows us that violence impacts college students in particular ways, including academically, with worse outcomes such as lower GPA and greater academic disengagement for survivors who have experienced violence compared to college students who don't experience violence. Additionally, violence adds to their overall mental health burden with things such as anxiety, PTSD, depression, etc. And so the impacts of violence range from needing to involve law enforcement, to injuries, to safety concerns, to PTSD. Across the board, women experience greater impacts than men do, although of course we know male survivors are negatively impacted too. If you look at this slide, you can see here that the purple bars are women and the turquoise bars are men. And if you look across all outcomes, you see that women are more greatly impacted than men. If you look at the last row, you see any reported impact, and you can see that around 84% of women report that they have any impact from experiencing domestic violence, whereas around a little less than 60% of men report that they have been impacted by experiencing domestic violence. Unfortunately, we also know that some victims do not survive. 3 women in a day in the US are killed by their current or former partner. And unfortunately, this includes college students, including students at the University of Utah who have been killed by their current or former partner. So all of that is a lot, right? The numbers are huge. The impact on survivors is huge, with some people not surviving. So what I really want to focus on now is how to talk about assessment and safety planning with survivors. So how do we actually assist people who are in violent relationships? The first thing is that we should be using a trauma-informed approach and trauma-informed assessments, which include listening, validating, and honoring individuals' experiences. Unfortunately, it's a little beyond the scope of this 1-hour webinar for me to go over all of the aspects of trauma-informed assessments and approaches. But it is important to remember that we should be asking survivors, what happened and how has this affected you? For someone living with violence, asking is helpful. Silence is not helpful. So we want to remember to ask. Additionally, there are many screening tools that we can use to assess whether our clients are experiencing violence. And on the screen, I have some of the more common ones. These are generally validated, short, and free screening tools that can be easily added to standard intake forms with agencies to assess if your clients are experiencing violence. So you can see they all have various different acronyms, and many of these are used in settings such as emergency rooms, but could be easily implemented in other settings as well. And this brings me to a research project that I'm part of that I'm going to talk about today. This is a project led by Dr. Bethany Backus at the University of Central Florida, and I'm part of the research team. And here we developed an intimate partner violence screening tool specifically for college students. So on the last slide, we saw numerous different screening tools, but most of those are not specific to college students. And what we know that is, in terms of intimate partner violence and college students have very low rates of help seeking for incidents of domestic violence. Only 15 to 30% of students seek help after an incident of violence. Additionally, as I talked about before, violence is associated with a number of adverse outcomes. Research has found that by the time they reach college, among youth who had experienced teen dating violence, survivors reported increased substance use, negative mental health outcomes, and re-victimization. So screening presents an opportunity to provide treatment for health issues associated with violence and to also help increase students' safety and well-being, as well as decrease re-victimization. However, only 1 in 10 women were screened for violence in their last healthcare visit. We actually don't know the rates for other genders, men or other gender diverse individuals, as there's been very little research that covers other individuals. Notably, we know that about 43% of students use a healthcare provider on campus each year. So nearly half of students are accessing on-campus healthcare. Additionally, healthcare organizations, including the Institute for Medicine, the U.S. Preventative Service Task Force, and the American College of Health Associations, have been recommending that we have early identification and intervention with students around violence for the past decade. However, despite these recommendations, screening for violence on college campuses is neither standard nor common across universities. Generally, there is no standardized screening instrument that is used for college students across the country. If women are screened, or if individuals are screened for violence, generally only women are screened. We have limited information about other genders. Additionally, screening is often conditional. And what I mean by that is screening might be given to patients when they come into the healthcare center if they look like they need screening, or it will only be administered in the women's health center. So it's not done consistently across all students. And finally, the screeners that have been developed, as I mentioned, are not tailored for college students. So they don't include many of the common abuse types that we see among our college students. This includes stalking, use of technology facilitated abuse, and some of the more controlling behaviors that aren't necessarily physical violence. So this leads me to the current project that I'm going to talk about called Care on Campus, during which we developed and tested a violence screener for college students specifically. In terms of our methods, first we conducted a literature review, and we reviewed all of the existing screening instruments that have already been developed. And from those, we found 108 items, and by items, I mean questions, that could be used in a screener. We narrowed down this 208 to 13. So, and then the 13 item pilot screener, we had both campus stakeholders, so people like Title IX, people working in the health care center, and students review those through both surveys and interviews. And from that process, we were able to develop a final 10-item screener, which we are now piloting. And this asks about violence that students have experienced within the last 12 months and also within the last 2 weeks. So we are currently piloting this, and we have been collecting data for a little over a year on this, using this screener. This screener is unique compared to other screeners in that it measures different types of violence, including psychological, coercive control, physical, sexual, stalking, and technology-facilitated violence. So going above and beyond other screeners that typically focus mostly on physical violence. Additionally, our screener asks students about the impact of violence on their lives in terms of being afraid or unsafe, and also how difficult did the violence make it for them to participate in things like completing schoolwork, engaging in social activities, seeing friends, etc. So this screener that we have developed is really unique in several different ways. First, it includes gender inclusive terminology. So we have designed this so that people of all genders can be screened. It's not just for women students only. Additionally, it defines intimate partners as a variety of different types of relationships, including casual hookups and other language that students identify with more than they might a romantic partner. We have clear and standard protocols to do the screening. So screening is done for all students that come into the certain health pods where we are screening, and it is universally administered to all those students. The screener also includes other forms of violence, as I mentioned before, beyond physical violence, such as technology-facilitated stalking and coercive control. And finally, we're also interested in understanding the impact that violence has on students in terms of their fear and also participating in daily activities. So next, I'm going to review some of the pilot data that we have got thus far from the screener within one particular pod, which is the language at the University of Central Florida. So one particular department of the campus healthcare center. And this is from 259 students within the women's health department. So first, what we found is 26% of students say that they experienced someone making them feel guilty for not spending time or upset when they didn't respond to the phone or answer the phone or a text right away. 22% had a partner who was suspicious of them. 16 reported unwanted sexual experiences, whereas only 4% said that they experienced physical violence. Finally, we found that 42% of screened students indicated yes for at least one item in the past 12 months. And what this means is that nearly half, 42% of students who were screened within this healthcare center indicated that they had had at least one experience of domestic violence over the last year. For students who had been victimized, 7% said this experience made them feel afraid or unsafe, while 13% said it made it difficult for them to participate in social activities. 9% said it made it difficult for them to complete work or schoolwork, and 5% said it was difficult to see friends or family as a result of the violence. Additionally, this study was built to include a brief informational intervention for students where we could actually do a warm handoff to a domestic violence advocate for students who wanted this, meaning that the nurses within the healthcare center could literally take the student and walk them down to see an advocate who is embedded within the healthcare center. We also created a card with information about violence and resources, and that's what you see on your screen here. And this card was offered to all students, not just those with victimization, so that all students were able to learn more, whether it was for them or if they had a classmate or a friend who is experiencing violence, they now had access to resources. And what we found is that 87% of students ended up taking this card. So the vast majority of students at least took the card and hopefully were able to, do something with it, talk to their friends or look up those resources themselves. So all of this is to say that we know that a number of different college students in our study alone, we found that nearly 50% of college students said that they experienced some type of violence. So we know a number of college students are experiencing violence. And so one tool that we as social workers have to work with survivors is safety planning. And this includes making plans for how to best keep safe in various situations. My Plan is an app that we use for safety and identifying unhealthy relationships. This is particularly useful for college students. The app can help a person think about, is this relationship unhealthy? Is this relationship dangerous? It can help them get clarity around their priorities, strategies, and resources. And it can also educate them about, conversely, relationship green flags. And what I mean by that is healthy relationships, not just what unhealthy relationships look like. The website for this app is on the screen. At the end of this presentation, we will also be sharing this link in the chat so that you can check out the app yourself. So in terms of safety planning, a safety plan is a personalized plan to keep survivors of domestic violence safe. It is an ongoing conversation between an advocate and a social worker, or an advocate or a social worker and a survivor regarding safety. It may or may not be in the form of a written document, and I'll show you some examples of written document safety plans. And the safety plan should always be developed by and with the survivor, so not by the social worker or the advocate. And finally, Safety plans are flexible and can change depending on the circumstance of the survivor. So if something changes in the survivor's relationship, maybe they were with the partner and then they decide to leave the relationship, you can update and change the safety plan to address new safety risks. Importantly, a safety plan is offered as an option. It is, of course, our client's choice whether and when they would like to work on it. Remember our code of ethics around clients' rights to self-determination that says that they get to make decisions about the type of care that they would like to receive. This includes safety planning. So as I mentioned before, some safety plans are written, and what you see on the screen is a screenshot actually of a safety plan. And this is from the National Domestic Violence Hotline that has a number of different safety plans that you can work on with clients online, and these are free, and they are personalized. So you can choose different ones that are appropriate for different types of clients. Again, the website where these are found is on the screen, and I will be sharing these websites and these resources in the chat at the end of the presentation as well. So some of the items that you can see on the screen for this safety plan include information about where the survivor can keep their purse and keys ready and put them in a location in case they need to leave the house quickly. And of course, this might be if violence escalates, that they are ready to leave. Additionally, they can identify a person who they can request to call the police if that person either hears suspicious noises or maybe there's a code word, and if they get a text or a phone call with that code word, they know to call the police or even show up at the house. Other items on this example safety plan are, I can teach my children how to use the telephone so they can contact the police. So if children are in the home, that they also can contact the police if need be. So when are safety plans appropriate? One of the things that I really want you to remember, in fact, mainly the one thing, if you remember from this presentation, is the information that I'm going to talk about when leaving is not safe for survivors. So some survivors need a safety plan if they either plan to stay in a relationship or if they plan to leave the relationship. But what we do know in terms of research is the most dangerous time for a survivor is when they are leaving the abusive partner. In fact, 77% of domestic violence related homicides occur either upon separation or post-separation, meaning that the vast majority of people who are killed by their current or former partner, that happens as they are leaving or even after they have left. We also know that stalking and other forms of abuse may increase post-separation. So I show all of this information to make clear that if a survivor is leaving, they should have a safety plan in place. Leaving should require a lot of planning as it's a very dangerous time. I also share all of this information to really encourage you to think about how you talk to clients or other people in your life who tell you that they've experienced violence. We often think that we should just encourage them to leave and that will make everything better. However, we can see here that leaving is extremely dangerous, and there are times when we should not be encouraging our clients to leave. And I'll talk about what we can do instead, but that we need to support our clients in their self-determination and their own risk of their safety if they decide to not leave a relationship. So some people will stay in abusive relationships. Remember, it is their choice. If they leave, they might be in more danger than if they stayed. Also, there are a number of other factors that survivors have to balance when making these choices, including economic survival and the safety of their children as well. Remember, we talked about things like economic abuse, which can really limit a survivor's economic means and her ability to even survive or care for herself and or her children if she leaves the abusive relationship. So for those who stay in abusive relationships, they may face danger. These clients need to have a clear plan and preparation in place to help their survivor and their children maintain their safety. Additionally, if there are children in the home and with the survivor, they should have an age-appropriate safety plan developed for them as well. So some of the common things that we see included in a safety plan are thinking about how to maintain security during a violent incident. You might work with a survivor to develop a code, and this is a code word that they can use with friends, families, and neighbors that they can either text or call, or if it's a neighbor, say, whatever it is. And this code word will mean something. It might mean that you're going to call 911, or it might mean that somebody will come to the house and just be present if the survivor thinks that violence might escalate. We also want to work with our clients to teach them how to be safe within their own home. So this includes, if they believe that violence is going to escalate, things like maintaining proximity to exits. What I mean by that is staying close to the door during violent incidents so that they can leave if the violence really escalates. Also talking to our clients about where they would like to seek health care and how they would like to receive health care if they are injured during incidents of domestic violence. Another thing that is very common in different safety plans is having a to-go bag ready. And in this bag, the survivor can have things like toiletries, extra keys, extra clothing for both themselves and their children, and important documents. And I'll talk about what documents to consider on the next slide. One thing you really want to brainstorm with your clients is where to keep this bag. You don't want to keep it in the house or another place where the abusive party or the person using harm can find it. So you might place it outside of the home, in the car, if the abuser doesn't access it, in the garage, at a friend's house, at a place of employment. Somewhere where somebody can't find it, which could then increase the survivor's risk of violence if the abusive partner retaliates when they find that thing. Documents that you would consider including either in that bag or maybe having photocopies at work or another place that the abusive partner can't find are things like birth certificates, social security card, immigration documents, all of the children's records, including medical and school, and also birth certificates, social security cards, etc. And then financial information. So access to bank accounts, mortgages, etc. Should have photocopies of all of these kept in a safe place that the abusive party cannot find. Lastly, in terms of safety planning, don't forget about our pets. We need to find out where the pets can go if the survivor needs to leave the house quickly. So this could be at a neighbor's house, it could be at a friend's house. Some places have organizations who will temporarily foster pets during emergency situations. So find out where that place is and then keep extra food and supplies available so that if you need to leave, you can also bring the pet with you. Another option that is available to survivors is called orders of protection. These are also called protection orders or restraining orders. It kind of depends on the state you live in. And these are stay-away orders granted by the court. And it's important to remember that these are just pieces of paper. So literally the survivor goes to the court and asks for one of these protection orders, and then a judge can decide whether to grant one. They don't guarantee a survivor's safety. Some abusers are not scared by these and will continue to abuse someone even if a protection order is in place. So if we're working with clients, while protection orders can be helpful, they do not guarantee safety. And so we want to really encourage our clients to safety plan even when they have a protection order in place in case the abusive party violates that protection order. Additionally, some survivors have reasons to not want to involve the criminal justice system in their relationship. This includes rightful concerns that such involvement might result in greater danger from the person using harm. So somebody might retaliate and actually find out when they are served with the protection order and then go harm the survivor. So when we're working with clients, we need to really take all of these things into account and not push things like protection orders unless the survivor thinks that that would be a helpful tool for them. So over the next few slides, what I'm going to talk about is what to do when you receive a disclosure of violence. This could be a client who tells you they are experiencing abuse, or it might be a friend or a coworker who tells you things about their relationship that you find concerning. In these situations, I think we all wonder, what should I say? How do I communicate my concern without dictating to my client that they leave the relationship? How can I ensure that my reaction is supportive, engenders trust, and doesn't further isolate the person? So I'm going to review some kind of simple yet effective techniques. What I would love to do in the chat right now is actually a brief poll, and you can just answer Y for yes, N for no, or U for unsure. But I'm wondering, have you ever had somebody disclose an experience of domestic violence to you? What I mean by this is, have you ever had somebody tell you that they are experiencing violence? This could be verbal or written. It could be via text. So go ahead and just think about if you've ever had this happen, or if you're not sure, if you've not had it happen. What I would guess is the majority of people in here have had somebody tell them that they have experienced something. It might not be in these exact terms, but many of us will have somebody disclose violence to you. And thank you, those of us who are participating. I appreciate it. So before I jump into kind of the nuts and the bolts about responding to disclosures, I'd like to highlight why this is so important. Research tells us that most survivors would disclose to somebody, but often a friend or a peer, and not a formal source of support, such as a healthcare provider or a social worker. Survivors often have a strong sense of distrust of formal systems, as many survivors have been victim blamed. So appropriate responses to disclosures can ensure that systems are trusted resources for survivors to access. Additionally, research shows that how we respond to a survivor who discloses their violence can impact that survivor's recovery. Research shows that positive, supportive responses are associated with better outcomes for the survivor, and that negative responses, such as victim blaming, can actually harm healing and recovery for the survivor, even long term. So what we say really matters. How we respond really matters. So in terms of response, there's a few different principles that I have on the screen here. First, know what you have to report to law enforcement. Child abuse and abuse of vulnerable adults is a mandated report. If you suspect those things, tell your clients right away so that they know that you're going to report it. Know where to refer. Know what type of help your client needs. Do they need a domestic violence shelter? Do they need mental health resources, legal help, law enforcement, a SANE, a sexual assault nurse examiner? Know these resources and refer appropriately. And finally, don't assume that just because somebody is not physically injured or the relationship seems non-serious to you, that it was not impactful. Statements like, well, at least you're not hurt, are not helpful and can even minimize the harm that has come to survivors. Additional principles of responding to disclosure include the ABCs of responding. A is for allow the survivor to feel comfortable and establish rapport. Use your active listening skills, both verbal and nonverbal, to reflect concerns that you hear. B, be a good listener, and be non-judgmental. Listen to what is said. Don't plan your response in advance. Be non-judgmental in your tone and your words, even if you disagree with their choices. Remember, it's not our place to tell our clients our thoughts on the decisions they made, whether that be the substances they took, what they wore, who they were with, and if they should leave their relationship. And finally, C, give control to the client. Ask for their input. What would they like to see happen next? Don't make choices for your client unless, of course, it's one of those things that you are mandated to report on. So here are a few basics to start us off with in terms of what we can do and what we should not do. So do believe what you are being told. Do start a conversation if you have concerns or think somebody is being harmed. Listen to what you're being told. Express concern for their safety if you have them. You can tell somebody as simple as, I have concerns for your safety, without being directive or telling them what to do. Encourage them to seek support from a domestic violence specialist, including local and domestic violence agencies that I'll share at the end of this presentation. Support the choices they make, including the choice to not leave the relationship, and work with them to make these choices as safe as possible. On the flip side, there's things we should not do. Don't aggressively question them about their choices. Don't try to fix their problems for them. Brainstorm with them about what they want to do. Don't tell them what they should do. Support their choices and help them think through options. Don't pressure them to talk about things they're not ready to. Some things, such as sexual violence, are particularly humiliating, and people may not want to talk about it. Don't just focus on the abuse. Let them lead the discussion in terms of what they want to talk about. And of course, don't judge them for their choices. These are extremely difficult situations, and people are doing the best they can to survive. They know their abuser better than you will, and they know what can trigger abuse. So support their choices. All right, so that's a lot of information, and it's a lot of kind of like great in theory, but what do you actually say in the moment, right? And I'm going to give you just a few examples. First, you could say, I'm glad you had told me about this. Or you could say, I want you to be safe. Expressing safety is a main key goal for us as social workers. You could say, let's make sure you get the help you need. Or, it's not your fault. This is important as many survivors blame themselves. You could also say, I believe you. Again, many survivors think nobody will believe them. This is helpful. You could say, I'm worried about you. Or even, you did the right thing by telling me. These are just a few examples of what you could tell a survivor. So briefly, in just a few minutes that I have remaining, I have a few more slides, and I want to talk about what to do if you had this brief case study. If you had a client disclose that they are being abused by their partner, they have not told their family, and they made it very clear that they are not interested in leaving the relationship. What I want you to do is think about which one of these phrases sounds natural to you and which phrase you would use. You're welcome to put the letter for that phrase in the chat, but mostly I want you to remember this so that when somebody discloses to you, you have this language ready to go. So again, you can say, A, I'm glad you told me about this. B, I want you to be safe. C, let's make sure you get the help you need. It's not your fault. I believe you. I'm worried about you. You did the right thing by telling me. So if you feel comfortable, go ahead and put the letter of your response in the chat. And also, I hope you really remember that for future. And the last thing before I talk about resources is how to talk to clients and assess how serious the abuse is without judgment or making the client feel attacked or defensive. So on the screen, I have a few example statements of things that you can say where you try to assess how serious the violence is without making them feel defensive. So statements like, can you tell me more about your relationship? Has anything happened recently that you're concerned about? Can you tell me more about what communication looks like in your relationship? Is this the first time this has happened to you? And do you ever feel afraid or unsafe? And finally, before I open it up for questions, I want to just share some resources. And again, these will be put in the chat. I have 3 key resources up on this slide. The National Sexual Assault Hotline, and in the chat, we will also put the website for all of these, which has both a hotline and a chat line. So people can either text, chat, or call. Same for the National Domestic Violence Hotline. There's a phone number and there's also a chat line. Finally, if you are at the University of Utah, we have a victim support advocacy office. The website will be in the chat, and we have here their email and their phone number so that if you are a student and you've experienced something, you have these free confidential services that you can turn to. So on that note, I want to thank you so much for your time and attention today, and I welcome your questions in the Q&A box now. I will stop sharing, and then I'm going to open those up. Okay, so I'll just start at the top, and I'm going to read these out loud. Do you think the percentage of college students reporting domestic violence in your pilot study is a conservative estimate of the actual numbers of students experiencing violence. I feel that there are many college students who don't stay on top of their doctor's appointments or perhaps don't trust their provider to disclose that information. This is such a great question. I really appreciate this. I think a lot of college students experience things, and the number of students that we were screening, or the population of students that we were screening, was only those who were seeking help for healthcare related issues, right? So it's not a screening of all students across the campus. And what we see is the numbers when we look at all students is about 1 in 4 students will have experienced something. So I actually think our numbers were maybe a little bit higher, in part because we were just in the women's health pod, and so we were just screening women. If we had also been screening other genders, we would have actually seen lower rates. And I hope that answers your question and makes sense. The next question. Has the Care on Campus screening tool only been piloted at the University of Central Florida? When might we have it available at the U? That's a great question. I would love to bring it to the U. I have actually today applied for some funding to try and do some of the pilot work here at the U. So I am in conversations with 4 different departments right now, including the healthcare center here at the U, to try and implement screening for U students as well. And I'm really hoping to get that underway in the next year or so. So great question. Next question. How should we handle it if we are seeing a couple for couples therapy and it becomes clear over time that there is some type of abuse going on? Oh, these are such good questions. I love this question. Couples therapy is not an appropriate intervention for couples who are experiencing violence. If that is the case, if you suspect that, you need to suggest that they seek help individually so that you can continue to see both people in the couple, but you should not be seeing them together. So again, however is appropriate based on your concerns, suggest that they do individual sessions with you. And that's because things that are disclosed within the therapeutic sessions could then actually be used by the abusive partner against the victim. And so it makes it a not safe space for them. It also makes it ineffective in terms of many of the things that we would hope to accomplish in couples therapy. So that's a great question as well. The next question. Are you aware of any financial resources specifically to assist survivors with legal fees associated with protection, restraining orders, or divorce? This is another great question. I will tell you that resources vary from state to state. So again, it depends. But the number one resource that you should remember that can help kind of navigate clients to the resources that are available in their area is the National Domestic Violence Hotline. So if you or a survivor calls that number, they will get hooked up with local resources so that person can give them kind of local resources. I will say many different states or many different areas have different resources available. I personally, I used to work in Seattle, Washington, where I was a legal advocate. And the state of Washington actually provided advocates free of charge to survivors who would help them fill out their protection order paperwork. So it really does depend, but the National Domestic Violence Hotline is the best resource to figure out what is appropriate for that survivor, depending on their state and actually depending on their county, because legal systems are divided by county. So great question. Next question. Do you have a couple recommendations specifically for law enforcement officers who might need to respond to an emergency calls about domestic violence or intimate partner violence? On the macro meso level, what would you ideally like to see police departments implement? I love the meso macro level part of this question. I love all of this question. So again, this depends by jurisdiction, but some police departments actually have advocates who ride along with the police officers and respond to domestic violence calls. So they would actually be embedded in the police department. And when they arrive on the scene, the domestic violence advocate would work with the survivor separately than the police investigation, which is more on the criminal side. So they would do things like provide resources. They would assess for safety to see if the survivor needs to leave the house, also for the children. So ideally, in my ideal world, I would love to see social workers embedded within law enforcement agencies. We know that not all agencies are receptive to that, and not all agencies are resourced for that. I will say that many law enforcement officers receive minimal training, so at least they should be receiving some training. But I think ideally, if we can't have social workers embedded into their systems, would be having more training on things like trauma-informed responses. And there are agencies who provide that training to law enforcement officers. It just really depends on kind of the dosage, how frequently they get those trainings, and what those trainings look like. All right, the next one. First off, I would like to express my gratitude for mentioning, and this is the student who was killed at the U, and honoring her memory. My question has to do with best practices with navigating clients who disclose domestic violence that occurs in the presence of a child. We want to support the survivor, but also have reporting duties to Child Protective Services. So a number of good questions and points, and I really appreciate kind of you calling out some of the things that have happened here at the U. I would also say that there's, if domestic violence is occurring in the context of children witnessing it or being abused themselves, it really is much more tricky than kind of what I presented here today. So of course, if children are being harmed, there are mandates around reporting. So that's the number one thing you need to remember. If the children are being harmed, you have to report that, right? Child abuse is a mandated report. And each kind of jurisdiction and state has different laws actually around if you have to report exposure to violence. So you would really want to be very clear about what the local laws are around if the child is witnessing violence. And I believe actually that's perfect timing. Dean Osteen is back, and I believe that is all the questions that I have in the chat here.
Dr. O'Connor, I just want to thank you so much. You know, when we were looking to bring new faculty in, we were just so grateful that you chose to come to the University of Utah. And as you acknowledged, we have a really tragic history here, as unfortunately so many college campuses does. So, you know, again, thank you so much for becoming a part of our community. To everyone who joined us today, thank you for being here. For attendees who are seeking continuing education hours, please watch your email in the coming days for links to the recorded presentation and a brief quiz. Upon successful completion of the quiz, a confirmation of CEU hours will be emailed to you. The College of Social Work is committed to taking the evidence generated through our research and from our labs, not only to the future social workers sitting in our classrooms, but also out into the community and to practitioners beyond our state lines. We hope you will join us again for our next event, which will be held next Tuesday, March 4th. This webinar, which is also part of our Social Work Beyond the Classroom series, will feature Dr. Tiffany Bafor, who just returned from a planning trip to Africa. She will present multicultural insights through experience, enriching education by learning abroad in Ghana. You can find the registration link and details about all of our events on the college events webpage. And until then, thank you for being a part of this event. I hope that you will be kind, be safe, and be well. Take care all.